Skilled Nursing Part 2. Majority of the time, patients that are in nursing facilities are rehab patients, and a lot of them do go home, and they will need home health services such as yours. Majority of these patients are dealing with cardiac issues as well as ortho issues. And so what you want to do is you want to be able to position your company on how amazing your ortho, your cardiac programs are, and how it can truly help the patients. But remember, all agencies that will go to these facilities to market themselves, the first thing that they're going to push is their quality of care, how amazing their quality nurses and staff are, how they provide skilled nursing, how they provide therapy, how they provide occupational therapy, how they provide speech therapy and home health aides. Guess what? That is what you do too. And that is what everybody is saying as well. What you need to do is tell a story about what your company does, what your company is offering. Imagine if you can tell them that your staff are certified or are trained monthly and explain to them how amazing your ortho services are. Don't just say we have therapy. Tell them about those amazing programs that I helped you create. Tell them about how amazing that, when patients get home, you can make sure that you will transition them to their house easily. Tell them how you have a caregiver training program where you will train the family members as well. Look, the family members of these patients are nervous. If it's the first time that their mom or their father was admitted to a rehab unit, they probably saw how it took three shifts to take care of their parents. All these therapists, all these occupational therapists, now their family member has this brand new diagnosis. They are scared on what they can do. They are scared that when the parent goes home, they're not going to know what they do. So imagine if you push to these skilled nursing facilities that your agency has a caregiver training program. And when you go ahead, don't just say we have a caregiver training program. Explain to them the steps that you will do in order to be able to train the family members. Talk about how you will have a coach that is available to be called 24/7 by that family member if they have any questions. Tell them how you have video training that makes it easy for these family members to be able to just log into your website and find all these videos that can help them. That your website or your training website has all these PDF white papers that can describe to them the easy step-by-step basis on how to change a Foley bag, how to safely transfer their parents from the bed to the wheelchair and from the wheelchair to the commode. These are things that you need to do. Tell them a story of how amazing your company does. Don't just say what you do. Tell them and show them how you do it. It's not what you do, it's how are you able to actually do it. And the only way you can explain that to them is on a step basis. Tell them, step 1, this is what we're going to do. Step 2, this is what we're going to do. By being able to be clear on your presentation, and that's why we actually have our own presentation training program to actually show you guys how to properly present things correctly. Presentation is everything. You don't want to go in there not prepared. Look, your team, your staff needs to be properly trained. They need to make sure they practice, they drill, they practice, they drill, they practice, they drill. So when the time comes, they know ultimately what to say, when to say, how to say things. And you'll be surprised that when you put your marketing team, or when somebody puts you on the spot, or when you even put your own administrator and director of nursing on the spot, they don't know what to say, when to say things. And you need to be able to have your 30-second elevator pitch about your organization, your 3-minute pitch, your 5-minute pitch, your 15-minute pitch, and ultimately your 30-minute presentations. These are things that are vital for your company to be able to survive. Now let's go ahead and talk about basic things. If you're not aware, most nursing homes have an administrator. That ultimately is the top dog in a nursing home. And this is a person that you're going to try to get a hold of. This is the first person that you're always going to try to get a hold of, because that person will direct you to the right person who's in charge on who makes decision on presentation of services, of choice of services. Just like getting into the preferred list for hospitals, you want to be able to be in the preferred list of the nursing home. Okay, this is what you want to ultimately be able to do. One thing I've actually done at one point is I spoke to the administrator of a nursing home, actually of several nursing homes, and what I did was this. I said, do you guys have a detailed list of home health agencies that you are using right now to refer the patients to give them a choice? Yes, they do. But one thing that you can offer is you ask them this. Look, I was hoping if I can actually make a flyer for you guys that's going to detail information about the basic services of home health agencies. And what I will do is I will put every single home health agency that you are referring patients to choose from. And you ask this question and you tell them, and this is a good thing to show the patients, to kind of give them a clarity of what home health agencies are and what they are expecting. And all you're going to put in this flyer are the basic services of home health agencies. You can then also tell the facility that what you're going to do is you're going to give them a top 10 questions that they should ask home health agencies if they use those, or the top 10 questions that they should look into a home health agency before choosing a particular home health agency. Remember and see what I'm doing here? It's another educational based marketing material that I am creating. Now, when you create a paper like this, you can ask the administrator, look, I was hoping, since I'm going to be making this, is it okay if I put my name on top of the list? Most of the time they will say yes. Because look, the discharge planner sometimes do not have the time to explain what home health services are. So imagine, here you are offering your services to be able to create a paper, a pamphlet, a brochure, a flyer to the administrator to make their transitions way better for their patients. So once again, you're putting that educational based material put together for that. It makes you look good. It makes you look valuable. Just that simple technique will be able to get you in the list of those nursing homes. Just plain and simple. Another thing that I actually offered is this. I asked the facility to say, and I asked them, I said, look, where do you put the brochures of all the home health agencies that you refer patients to? Most of the time, each agency will have their own flyer stand, okay? And those are nice flyer stands, but then it gets cluttery and gets very messy. So what I've done in the past is I've actually purchased brochure racks that has multiple slots there that every single home health agency can put. I asked them if I can put that and if I can give that to the facility, and then they can either hang it in the hallway if they want to, or they can go ahead and put it right by the discharge planner's office. It makes everything more easier, it makes everything clutter-free, and it organizes things for them. What your job then to do is to make sure that it's properly stocked. It gives you a reason to always come back to make sure that everything is fully stacked. And you're going to show the nursing home, you're going to show the administrator, the discharge planner, that you are fair. You allow everybody, once again, everybody's flyers to be put in there. Ultimately, that's the best thing. You are being fair, but what you're going to do is you're going to strategize how you place your flyers. How are you going to do that? You're going to put yours right in the middle. Right in the middle is where you're going to put your flyers, because you're never going to make sure that you're going to pay for this. You're going to go ahead and contribute this thing, and all you're going to do is you're going to put your flyers in the back end. No, you put everything in the middle. Why is that? Because that is how you position yourself. When you go in a grocery store, the person who is able to have their items, their products in the middle of everything is always going to be chosen first. So by you doing this, you're strategizing things right there and then. And also, I always love these brochure racks, in which in the brochure racks, they actually have a slot where you can put an educational flyer. What I do is every time that I walk in, I have a brand new educational based marketing material that I put there. So then I will tell them that I will change it every month. And so it gives me another reason to be able to go back into the facility to replace things. Remember, you need to make and create any reason that you have to keep on coming back to these facilities. Whether you're getting a patient or not, you want to be able to maximize that. Just as I've spoken before, where you have to visit the physician's office every 7 to 10 days because you want to be at the top of their mind. You want to be right in the top of their head when they think or when they have that patient that has or needs home health services. You want them to think about you so they can refer you automatically. Imagine that if you are the one providing so much education, so much valuable information to them, who do you think they're going to want to work with? And the thing though is they cannot always recommend you automatically. They have to give patients the choice. But if you've given them so much value, sometimes these patients are going to ask them, well, who do you recommend? Well, if you're the first in their mind, they're going to talk about you first. But then they still have to go ahead and talk about the other agencies. But if you've been on top of their mind and if you've given so much value, you're going to hear it in their voice when they talk about you to the patients that you're going to always look better. They're going to use additional words to describe how amazing your company is. So remember, these are few techniques to be able to get into these skilled nursing facilities. Most of the time, it's not just about services. It's how you cater, how you explain, how you tell the story to them that's going to make things more valuable. When we keep on talking to you guys about telling that story, I want you guys to think about this. When you guys watch commercials out there, are they just going to pump you full of information? You buy this, buy that, this is good, this is great. Those type of commercials you don't pay attention to. But the commercials, even the short 15-second commercial that's able to tell a funny story, that's able to tell or keep you related to a particular topic, is going to make you want to gravitate towards that and maybe purchase the product. I want you to start noticing how marketing works. Marketing works in regards to telling a story. The best products out there are the ones that are able to tell a story. A lot of the products out there are not number one, are not the best, but they're known as first in mind, okay? They're known as first in mind, and that ultimately is what you want to do. If you're able to do that, you're going to be able to present yourself as the home health agency, the best in their mind, and they're going to start referring patients to you.